making my own way, but I stumble and I falter every day. But I love my baby now. But I love my baby, I'm still learning how. Hey, 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 I'm okay. Stay with me. We'll be together.
Hello. Welcome to another episode of Pathways to Parenting Success. I'm Dr. Jan Hittleman. It's a pleasure to be here with you today. And we have a really important topic that we're excited to talk to you about. It relates to anxiety disorders. We're going to be discussing diagnosis and treatment of anxiety disorders, as well as providing some hopefully useful suggestions to folks that struggle with anxiety to help them to address some of those concerns. I want to start by thanking our partners, the Boulder Valley School District and Channel 22, without whom this would not be possible. We appreciate their partnership. And I'd also like to thank our other sponsors, which include the Daily Camera, the Boulder Counseling Cooperative, Boulder County Healthy Youth Alliance, Centennial Peaks Hospital, and the Temple Grandin School. We appreciate your support. On our program today, we're going to be discussing diagnostic concerns. We're going to talk about some of the different kinds of anxiety disorders. We're also going to talk about trauma and how that impacts anxiety issues, as well as treatment options, some simple techniques that you can do right now to help you address anxiety, and next steps if you or a loved one is struggling with anxiety. Please remember that if you're watching the show live, we would love to hear from you. If you go to our website, www.boulderpsychologicalservices.com, and just go to the events section and click on this event, there'll be a form there that you can send us questions. We'd love to hear from you, and we'll be asking those questions to our panel. I want to start by introducing our two panelists today. First of all, we have Kate Ellard here today. Kate is a licensed psychotherapist and a mental health coach for individuals and families. For 20 years, she's helped men and women with anxiety, depression, trauma healing, parent coaching, and navigating life transitions. She uses several approaches, including EMDR therapy, cognitive processing therapy, or CPT for short, mindfulness strategies, and walk and talk therapy. Welcome, Kate.
Thanks, Jan.
We're also joined by Dr. Sunda Friedman-Tabakhorst. Sunda is a psychologist in Boulder. She's done extensive work with anxiety disorders, particularly those that are trauma-related. Her work has included both research and clinical practice. She provides diagnostic assessment as well as therapy for adults in her private practice. And we're going to start off today discussing some of the symptoms of anxiety. Who would like to start off?
I'll jump in. There's a few different anxiety disorders, but the basic one, generalized anxiety disorder, the main character of it is this anxiety and worry about many things in your life. And you wind up spending a high percentage of your time, everyday life, thinking or worrying about these things. And it can shift from one thing to another. Sometimes that makes us kind of feel the urge to seek assurance from other people. So oftentimes when we have anxiety, we're asking for reassurance from our loved ones, our friends, our family. The worry and anxiety this is characterized by feels very challenging to control. It feels very hard to stop the worry. And it also comes along with about 3 physical or cognitive symptoms if you have the diagnosis of a general anxiety. There's an edginess or restlessness. You may feel more fatigued than normal or tire easily. Often our concentration and memory is impaired. In our muscle, we have a lot of muscle aches and pains, and a lot of that is from the tension, the anxiety kind of builds in our body. And often we have difficulty sleeping, which of course compounds the problem, because if we don't sleep enough, our body is a little more edgy and makes everything a little worse. So it becomes kind of a vicious cycle there. Those are some of the basic symptoms, Jan, of a general anxiety disorder.
Thanks, Kate. Anything you want to add there, Sunda?
No, I think Kate covered a lot. I think there are, anxiety is a very broad category, so there's a lot of types of anxiety, and I think what they share in common symptomatically is fear of an actual threat or anxiety about an anticipated threat that is out of proportion to the actual threat for a persistent period of time. Generally, we mean 6 months or more by that, that is causing problems in living, causing you to suffer some consequence or pay some price that you don't want to live with.
Thanks, Sunda. And this is an important point that Sunda raises. We always look for excessive fear or anxiety. That's usually a critical benchmark to any anxiety disorder. And just to give our audience an idea, we're going to be focusing primarily on issues related to generalized anxiety disorder. That is certainly the most common anxiety disorder that is diagnosed. But just so our audience knows, there's a variety of other anxiety disorders as well. Another fairly common one is social anxiety disorder, and this is for folks that really have a lot of anxiety around social situations, fear of being judged, behaving in a way that might result in embarrassment or lead to ridicule. This is another fairly common anxiety disorder. And then there's a variety of phobias that folks have. I know for myself, I do not get along well with spiders. Don't like them. I'm not sure I have a phobic reaction, but I'm sure I'm not happy about it. And then one of the more common phobias is agoraphobia, which would be more of a fear and or anxiety regarding at least two of the following: public transportation, open spaces, enclosed places, standing in a line or being in a crowd, being outside of the home alone. This is another fairly common anxiety disorder as well. We also have separation anxiety disorder, and we often think about this with children, but actually adults can struggle with separation anxiety disorder as well. Usually involves excessive fear or anxiety regarding separating from those to whom we have attached. Another anxiety category is selective mutism, and this is where a person does have adequate language development, but they do not communicate verbally in social situations where there's an expectation for speaking. This is something that we do see in kids, and we sometimes see in adults as well. And finally, panic disorder, which is a very, very difficult disorder, usually comes on without warning, can be very frightening, and really requires some therapeutic intervention. I'd like to move now to talking about trauma for a few minutes, because trauma is often a factor that can be related to anxiety. And I'll ask Kate Eller to start us off with that in terms of her experience working with trauma and anxiety. Kate?
Thanks, Jan. Yeah, trauma-related anxiety is sometimes called PTSD. And that's how we kind of differentiate PTSD, meaning post-traumatic stress disorder, from a general anxiety disorder. Because an event in life, a troublesome event, a trauma, is kind of driving the anxiety. And so it all looks a little differently than a general anxiety disorder. Often, when we have a traumatic event, now this can be everyday trauma. There can be social slights that kind of traumatize us, and we start to excessively think about it. Trauma in relationships. And then there can be extraordinary trauma, based in violence, abuse, and wartime violence. The anxiety is brought on in these situations by kind of a hypervigilant nervous system, realistic flashbacks to the events that occurred, and a persistent rethinking of the situation, kind of reliving the events, and these real intrusive thoughts. That's what I meant by the persistence. Real intrusive thoughts, triggered greatly by reminders of the event or just startling things in our environment. Sometimes just something startling in our a car backfiring can startle someone who, say, a veteran who has been in the war and had in the middle of gunfire. And it can have them relive the entire wartime experience again. And it's very frightening, very unnerving, and it interferes with everyday life. PTSD as a disorder may not be attached to someone who has some anxiety about some of the everyday traumas that we have, but sometimes it can just be real bothersome, and the treatment related to it can be the same. It would just be less complicated when The trauma is a little more of everyday tough things. Are we talking about treatment at this point of trauma-related disorders?
We're going to get there. And I'm just wondering, I know, Sunda, you've had a background dealing with trauma, and both as a clinician and also in terms of the research that you've been involved with. Anything you want to add in terms of trauma and anxiety?
Yeah, I think, when we talk about trauma, we talk about some specific things, including, like Kate said, the intrusive thoughts, the arousal of the nervous system, problematic alterations to both cognitions and mood. And there are two things in particular that both trauma and other anxiety-related problems share, which I think can be particularly troublesome, which are avoidance and arousal. And I think that avoidance is a key concept in both trauma-related anxiety and other anxieties, because what happens is I get afraid of fear itself, or I get afraid of my own internal experience, and I can't get away from my own internal experience. And so it becomes a very nasty cycle of continuing upping the ante, so to speak, on trying to avoid troublesome thoughts, troublesome triggers in the outside world. And I think both in terms of trauma and in other anxiety disorders, that can be a really critical point of intervention and diagnosis.
Thank you, Sunda. And just to remind our viewing audience, we'd love to hear from you. You can send questions directly to us through our website at www.boulderpsychologicalservices.com. Click on the events section and this event, and it'll have a form for you to submit your questions. We'd love to hear from you. And also for members of our audience, if you have any questions for our panelists, you have those index cards. Just jot it down, and we'll be happy to answer your questions as well. Next, I would like us to talk a little bit about diagnostic approaches, and there's actually a variety of treatment options when it comes to anxiety, as well as trauma. We'll talk about both of those things next. And I thought we'd start with Sunda. Sunda, maybe you could give us a little introduction to how we might, diagnose folks with these or other kinds of issues, some of the diagnostic options that we have.
Yeah, sure. Thanks, Jan. I think there's two basic routes to go in a diagnostic process with anxiety disorders. The first one is probably the most common, and it's a basic kind of clinical diagnostic interview. And this is when you would sit down with a clinician who's going to have a series of questions to understand as best she or he can your symptom pattern, how long this has been going on, and really understand what's going on for you and come to a diagnostic place based on that information. So clinical interview is one option. On the other hand, the other option that we might use as psychologists is the diagnostic assessment. So a formal kind of testing environment where we sit down with standardized instruments that will help to measure in a quantitative way what's going on for you, how you're experiencing that, and yield some diagnostic answers. And it doesn't have to be one or the other. Sometimes people use just clinical interview, or sometimes people might use a combination of those two different approaches to arrive at some clarity about diagnostically what's happening.
Mm-hmm. Mm-hmm. And we, like with any psychological disorder, we want to be really clear about diagnosis up front. For example, as you might have heard earlier when we were talking about the symptoms of anxiety, one of them is problems concentrating. And it's been fairly common in my experience doing psychological testing, like Sunda referred to, especially with children and adolescents that come in with concerns around ADHD. And on many occasions, I've tested children who really looked like they had ADHD on all the survey forms that parents and teachers, even the students themselves, completed. They endorsed all of the symptoms of ADHD. However, with more in-depth diagnostic testing, it became really clear that anxiety was actually the underlying issue and not attention deficit. And this is very important because, as you probably know, when someone is accurately diagnosed or unfortunately inaccurately diagnosed with ADHD, medication is often a part of the solution. And these are serious psychotropic medications. They're typically stimulant medications. And, if you're having problems concentrating because you're anxious, the last thing you want to be put on is, a stimulant medication, that's probably just going to trigger more anxiety. And so we want to really be thoughtful about diagnosis before we move to treatment. But let's assume that this is something that was done expertly and the client does have diagnosable anxiety issues. Let's talk about some of the treatment options that are available. And I thought we would just start with Kate, just to kind of tell us a little bit about some of the unique approaches that we use when anxiety is trauma-based. Kate?
Thanks, Jan. EMDR therapy is something I do, and Sunda as well, I believe, right? Yeah. And that's my go-to choice when anxiety is based in past traumas or bothersome events in the past. It's a combination, really, of what makes it EMDR and cognitive processing therapy or cognitive behavioral therapy, which has kind of been a standard for many years. So it's a combination of kind of all the best we have as therapists right now, in my opinion. So it connects what I call it deals with the mind-body connection that happens with anxiety. You know, anxiety is such a physical and emotional disorder. It not only contains worrisome thoughts and anxiousness and feeling like you just can't solve these problems that are running around in your head, it exhibits the physical symptoms that we talked about. And it's related to the nervous system in our body. There's something called the vagus nerve is very involved there, if you ever want to look that up. And EMDR is therapy, and EMDR therapy is an approach that that kind of navigates that mind-body. It's a way to hit the memory system that it has the traumas and the past troublesome events in your memory system, in your brain. And what it does is it stimulates the information processing system that is already a natural system in our body and brain. And it kind of just jumpstarts that system so that these past events and troublesome memories can get kind of processed and kind of dissolved a little is the way I describe it. And it doesn't change our memories. It doesn't remove our memories at all. But it takes the emotional charge out of those memories. So we're not reliving them. Remember, when it's trauma-based, we kind of tend to rethink and relive some of the old stuff, and it gets triggered by new social environments sometimes. So what this therapy does is it kind of takes the emotional charge out of those old events. So we're not so stuck in them in the future. The basic process is, I don't know if you've heard of, EMDR stands for eye movement desensitization and reprocessing. And that is a mouthful. And it did start with eye movement techniques, when you just move your eyes from left to right, left to right. But now we know it's not just the eye movement. It's kind of the stimulation of left brain, right brain, left brain, right brain. So that's kind of the basic of where the name came from. And we just talk about some events and feelings while we're doing that left and right brain stimulation. It could be tapping on your knees, for example. So that's some of the basics of how EMDR therapy can work. And also we're doing cognitive behavioral therapy along with all of this. Mm-hmm. So kind of targeting our thoughts, rethinking them, and trying to have more adaptive ways of thinking about old stuff.
Could you help us, Sunda, understand that a little bit more, the cognitive behavioral approach? Now, I'm assuming that's something that we would use for anxiety disorders in general, as well as traumatic events, perhaps.
Yeah, I think that's true. I think it's important to make a distinction between cognitive processing therapy, which Kate mentioned, and cognitive behavioral therapy. And the reason is because what you just said, Jan, which is that cognitive processing therapy is really it is a form of cognitive behavioral therapy, CBT, but it's quite specific to trauma-related stuff. So that one we would probably reserve for trauma-related concerns. CBT is a more general approach. People have found very useful. Some people in terms of helping with all different forms of anxiety. And it starts from a place of understanding that thoughts and feelings exist in a mutually determinative loop. So what I feel influences what I think, and what I think influences what I feel. And so if I can interrupt that cycle by kind of changing the stories that I'm telling myself about myself, the world, and others, that will change the way I'm feeling. And so that's the kind of 2-cent version of how does CBT work. But it's been a very powerful model for a lot of people, and particularly with anxiety-related disorders.
And, for the average person looking for help with some of these issues, let's say they've experienced some significant traumas that are creating a lot of anxiety symptoms for them. How does the clinician decide between a CPT approach, an EMDR approach? How does that work in your practices?
I usually describe the different methods to my clients. We talk about them, I answer their questions about them, and kind of let them lead the way of what feels more comfortable. The good part, and I don't know what you think of this, Sunda, the good part for me is that in a way we can start in one place and move into another, and they're not so exclusive that you can't move between each one along the way. That's how I approach it.
So you could use both in treating someone, not necessarily one or the other.
Yes, yes.
And I'm assuming, with trying to be of service to folks that are struggling with these issues, it's nice to try a few different approaches, because I'm guessing in your experience you found some clients really do well with approach A, whereas others do well with approach B, and I'm guessing that's part of the benefit of exploring some different approaches with that client to see what works best.
Absolutely. I think that's a really important point, because people have different natural tendencies of how they are in the world. And so, a great example is cognitive processing therapy is a very specific approach. And so for people who have a very concrete thinking approach to the world, that can be a really useful way to begin to work. For other people who maybe are more abstract thinkers or more connected to their body than to their thoughts, we might use a different approach out of the gates. ACT is a newer therapy, acceptance and commitment therapy, that kind of puts those two together. Mindfulness-based cognitive therapy is a great kind of offshoot of CBT that helps to incorporate some of that body stuff. So absolutely, I think the person that we are working with is really important in considering how we are going to work.
Mm-hmm. And what's going to be effective.
Mm-hmm. Right.
And in terms of approaches to reduce anxiety, I thought it would be helpful for us to have a little bit of a discussion around, simple strategies that our viewers can use. Maybe they don't have severe anxiety that warrants diagnosis and treatment. Maybe they are struggling with anxiety but need a few extra tools. And so I'm going to ask our panelists to brainstorm with me a little bit in terms of some strategies that people can use every day to deal with anxiety. I know that cognitive behavior therapy has been shown to be very effective in treating anxiety. And just to give our audience a very simplistic example of how cognitive behavioral therapy works, I'd like to share a personal story. When I was in graduate school in New York many years ago, I would be driving on the highway, and I'm sorry to say, being a New Yorker, New Yorkers are not the most courteous drivers that there are. And there would be many times that I'd be driving on the highway, someone would cut me off, I'd get very angry, I might get even a little road ragey and think, oh, I'm going to follow that person. Now, luckily I didn't, because I think I would lose whatever fight I got into. But it's amazing where our mind goes, right? When we're in traffic and we get upset, I would start to get really angry about people cutting me off, etc. And then when I was in graduate school, part of what I learned about, Sunda referred to it earlier, was psychological testing. And one of the facts that I learned about psychological testing, specifically about intelligence tests, is that the average IQ is 100. It's at the 50th percentile. This means that half of us have an IQ above 100, half of us have an IQ below 100. Now, we would all like to think we're in that other group, right? Above 100, but half of us have an IQ below 100. After I learned this fact, the next time I was driving on the highway in New York, of course I got cut off again. This time, I thought to myself, maybe it's one of those people that has that under 100 IQ. Now, I was still a little upset about it, but I was far less angry than I was initially. And that may or may not have been accurate, right, that statement, but notice how just a little change in my thinking significantly impacted my resulting mood and my anger was lessened. I was able to drive more effectively, etc. So a simple example for you to think about. This is something that you can incorporate in your own life as well. And maybe our panelists can help us with some strategies as to how to do that. Who would like to start us off?
I think there's lots of different ways to approach this and simple little things that we can do. And I think some of them focus around this very important idea that the body and what's happening physically in the body is so key to anxiety that starting there can be really useful. People who are feeling anxious are very aware of what's happening in their body. Their heart is racing, they're breathing fast, they're sweating, and that becomes a very focal point of their experiences. And it can be quite frightening because it feels out of control. Mm-hmm. And so using little techniques to put yourself back in the driver's seat and kick anxiety out of the driver's seat can be really helpful. So for example, breathing is a very fundamental part of being in a body. And so when we find ourselves in a situation where anxiety is coming along and trying to nudge us out of the driver's seat, taking a moment and really coming back down to the very, very basics of breathing can be a focal point. It can be a place where we can get back in control. So there's different ways that people do that. One of them is just a very simple count. Count in, 1, 2, 3, count out, 1, 2, 3. And in a few breaths, I think most people find that helps them feel back at least a little bit in control where they can make more choices rather than feel like the anxiety is on a runaway train. So I think, breathing is a good one. There are lots of other kind of body-based choices, and I think they're really useful because one of the things that happens with anxiety is that the body cues themselves become trigger points for more anxiety, right? So my heart's going to start racing, and then I'm going to become afraid of the fear that happened the last time my heart started racing, and I'm on a train. And so that's another one. It's just awareness of my heart rate, and the story, as you say, that I'm telling myself about that. I felt my heart rate go up. That means I'm about to have a panic attack. That means I'm going to die, and I'm never going to get out of this, and I'm going to go crazy. So being aware, I felt my heart rate go up, and then taking a moment to center yourself in your body and make a choice about the story that I'm going to tell. Oh, okay, my heart rate went up last time I had a panic attack, and I didn't die. And so being intentional about the thoughts associated with the body cues can be also a really important way to be in the driver's seat.
So in terms of anxiety, then, I guess we want to be more in control of our thinking than allowing our thinking to be in control of us.
That is a great way to say that, Jan, yeah.
And, Sunda brings up a good point about relaxation techniques. Now, clearly, this is a very effective strategy. And we have some clinical relaxation techniques that we train with our clients, and maybe some of our panels will discuss that. But, anything that you enjoy doing that's safe and healthy, that's relaxing for you, is a wonderful way to manage anxiety in addition to some of the strategies that we're talking about now. Other thoughts, Kate?
Well, I think Sunda's first choice of a stress reducer being breath is absolutely it. To me, that's the simplest. You can do it anywhere, anytime, no need for any gear or tools. So, and it's a focused breathing, because sometimes people say, well, I'm always breathing, right? So, but it's a focused breathing, like she mentioned, counting one to 3, filling up your belly with the breath and then letting it out. Take 1 minute of time and do that. It's extremely effective. The next one for me that's the two others that to me are the most effective is get your body moving and also reaching out to your social support network. Talking to a friend and laughing out loud with them, it just reduces stress, period. I know we can laugh about that, but the research is out there. It shows it. Calling someone on the phone or just even just being social to the clerk at the next store you're at and laughing a little, it will reduce your stress. The get moving piece is, okay, it's exercise, it's gardening, it's going for a walk, it's going for a bike ride, it's anything that kind of just gets your heart rate up in a manageable way, not in a panicky way. Mm-hmm. It adds to the it forces your body to breathe more deeply, which it's all related in that way. Again, like Sunda said, we're working on both the body, the physical, and the emotional here. So we know that walking 15 to 30 minutes a couple times a week greatly reduces people's anxiety and depression. So that's also a pretty simple one. Even it's walking around the block when you're at the office all day.
So being a little bit more aware of our thinking, I'm hearing trying to incorporate relaxation exercises into our daily routine, and exercise. Exercise for years has been consistently proven to be effective, not just for anxiety, but for depression also. It's a very effective strategy for our physical well-being as well as our emotional well-being.
Can I just make a quick point about that, Jan? Because I think sometimes that can be intimidating to people who feel like, oh no, now I have to go to the gym for an hour a day, 5 times a week. And that's not the case. What we're talking about when we say exercise is bring your heart rate up for 20 consecutive minutes, 3 or so times a week. Mm-hmm. Go for a walk, go for a bike ride, do something that you enjoy, but you don't have to become a gym rat. No. And I think that's an important thing. It doesn't have to be a big and intimidating commitment.
Right, and any small steps that you take in that direction is success, right? Any
Absolutely.
Small changes you make in lifestyle is success. Mm-hmm. I know we're running short on time, but I was hoping that we can quickly just touch on, what to do if you or a loved one is struggling with anxiety. I'm going to ask Sunda to help us with that question. Mm-hmm. What would next steps be for somebody that has these kind of concerns?
Yeah, I think, there's lots of options. I think one thing we didn't talk about too much today is medication, but that is one treatment option with anxiety. And that is something, if you're wanting to explore that, to talk with your physician about, your psychiatrist or your family physician. Otherwise, I think there's lots of choices to try some techniques at home, approach this on your own, see how it goes, to reaching out to do a kind of more formal diagnostic process and see about working on some therapy to help with it. That can be really nerve-wracking if you're already anxious, mm-hmm. right? Now I have to do this very anxiety-provoking thing of reaching out to somebody and talking about all of this, and that can be a big hurdle for some people. And what I would say about that is, that is difficult. I think that's a very common experience, and that's a matter of costs and payoff. If you're willing to keep doing this the same way that you're doing it, and it's not that big of a problem, right? Mm-hmm. Try some little things. Google relaxation techniques and become a real expert in 1 or 2 of them that really work for you. Mm-hmm. If you're really paying a big price and it's coming to limit your social sphere and your life in ways that are no longer tolerable, it may be time to reach out and ask a professional, what are my choices? How can I begin to work on this in a more intentional and focused way? There are lots of professionals in Boulder who are really helpful in that way.
And, consider the fact that, you may or may not need to be in counseling, but it's really smart if you're wondering, if you have concerns, to find a licensed mental health professional that comes recommended to you, who can just meet with you one time and do an assessment. We always do this when we have physical symptoms. We'll go to our medical doctor just to see, is there something I need to do in terms of the symptoms I'm experiencing. It's a really great idea with emotional issues as well. So that's something that we really want to think about. Because, the fact of the matter is anxiety is a normal emotion. We all get anxious from time to time. We also know that stress can have surprisingly severe effects on our physical well-being. And so even if you're not someone that's super anxious, we could all benefit from learning effective stress reduction techniques like some of the ones that we discussed today. Yes. So something to think about. You can find out more information about anxiety on our website, boulderpsychologicalservices.com. I want to thank our panelists for their time today. Really appreciate your help. And I look forward to seeing you next time. I can tell you that in April, Dan Fox will be moderating a talk on helping families successfully transition through divorce. So if that would be a benefit, please join us then. That will be on April 16th, and next month we'll be doing a talk on March 19th, helping your child deal with strong emotions. Thanks so much for being with us today. We look forward to seeing you next time. Take care.
And now the planet's done its bowing down. And soon the growth returns to follow ground. But I know what's churning underneath the snow. And I love my baby, and we've miles to go. Hey, 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 I'm okay. Be with me. We'll beat this, can't you see? So wait a while, winter time. Wait a while, winter time.